What is DAYAMINERAL and what is it for? DAYAMINERAL is a dietary supplement for the prevention or treatment of multiple vitamin and mineral deficiencies, especially in cases of restricted diets, deficient intestinal absorption and increased demand for vitamins and minerals, calcium and iron. Posology and administration. DAYAMINERAL drops is indicated in pediatrics and is administered orally in doses of 0.3, 12 drops, to 0.6 milliliters, 24 drops, per day. It can be applied directly on the child's tongue or mixed with the bottle, fruit juice and other liquids. The average recommended dosage varies between 12 and 24 drops per day. This posology can be increased according to medical criteria. Warnings. Do not use during pregnancy without consulting your doctor. Accidental overdose of iron-containing products is the major cause of fatal poisoning in children under 6 years of age. Under 6 years of age. Contraindications. Is contraindicated in individuals with known hypersensitivity to any of its components. Precautions. General caution should be exercised in patients with chronic hepatic insufficiency and in patients with hyperlipidemia. Vitamin D should be used with caution in patients with hypercalcemia. Increased sensitivity to vitamin D has been observed in patients with renal insufficiency and who have an abnormal calcium-phosphorus ratio. Caution should be exercised in patients with pre-existing thyroid insufficiency. Calcium salts should be administered with caution in patients with decreased renal function, heart failure, or sarcoidosis. Caution should be exercised when administering phosphate to patients with severely decreased renal function. Laboratory test interactions. False results are possible in occult blood tests. In occult blood tests, drug interactions, concomitant use of tetracycline and iron results in disturbance of absorption due to the formation of a complex. Therefore, these drugs should be administered 2 to 3 hours apart from each other. The effect of vitamin D may be reduced in patients taking concomitantly barbiturates. Concomitantly taking barbiturates and anticonvulsants due to accelerated vitamin D metabolism. Calcium increases the effect of cardiac digitalis glycosides and may precipitate digitalis intoxication. Calcium salts reduce the absorption of tetracyclines and thiazide-derived diuretics may increase renal reabsorption of calcium and may produce hypercalcemia. Concomitant administration of calcium, magnesium, or aluminum salts may trap phosphate and decrease its absorption from the gastrointestinal tract. Adverse reactions. Allergic reaction including rash, pruritus, and anaphylaxis have been reported with the use of vitamin preparations. Some components of these products have been associated with gastrointestinal effects such as heartburn, belching, abdominal pain and cramps, diarrhea, constipation, vomiting, nausea and anorexia. With several components, worsening of acne vulgaris or acneiform exanthema rash has been seen. With the use of riboflavin, bright yellow coloration of urine has been reported. Symptoms of chronic intoxication are as follows: headache, vertigo, hyperkeratosis, skin and mucous membrane changes, bone and joint tenderness and pain, fever, increased serum cholesterol and triglyceride concentrations, intracranial hypertension, fatigue, hypercalcemia, hyperglycemia, increased alkaline phosphatase, hypoproteinemia, low serum ascorbic acid, decreased protein content of the cerebral spinal fluid, decreased hydroxysterol and triglyceride concentrations, intracranial hypertension, fatigue, hypercalcemia. Hyperglycemia, increased alkaline phosphatase, hypoproteinemia, low serum ascorbic acid, decreased protein content of the decreased spinal fluid protein content, elevated urinary hydroxyproline and hypercalciuria, polyuria, increased frequency of urination, urinary incontinence, enuresis and acute renal failure due to tubular necrosis, papilledema, dryness, hemorrhage and lip fissures, yellow-orange skin coloration, decreased sunlight tolerance, pigmentary changes, hair loss and brittle nails, spider angiomas and edema. Moderate administration over prolonged periods of time of vitamin A, 20,000 IU per day, may cause significant hepatic failure including cirrhosis. The total cumulative dose may be a critical factor. Vitamin D intoxication includes the following features: hypercalcemia and deposition of calcium salts in various tissues. Occasionally, it has been reported mental alteration, cerebellar ataxia, peripheral facial paresis, apathy, and lack of interest. With the use of iron, black coloration of fecal matter has been reported. Continuous use of iron-containing liquid preparations may color tooth enamel. Overdose. High doses of each of the individual components of this product have been associated with eczema and exanthematous skin lesions, fatigue, and insomnia. Liver damage, gout, and ulceration have been noted with high doses of niacinamide. High doses of vitamin A can lead to hemolysis, anemia, neutropenia, leukocytosis, thrombocytopenia, aplastic anemia, increased VES, and accelerated trabecular and cortical bone resorption. Initial doses of vitamin D overdose usually constitute weakness, headache, nausea, vomiting, and diarrhea. Renal function may, at an early stage, be impaired with polyuria, polydipsia, nocturia, decreased ability to concentrate urine, and proteinuria.